All right, guys, so let's talk today about what are some of the more common side effects that you should be aware of when it comes to testosterone replacement therapy. I think this is something that a lot of my patients, especially if they've been somewhere else, feel like they did not know what they were actually getting into before they started testosterone. So we take a great deal of time to actually explain what you can expect when you choose to use testosterone if that is needed for your symptoms. So I like to break it down into things that are superficial. So I think of dermatological issues. That would be acne, which can be a little bit more cystic because your skin gets a little oily. We have bacteria on our skin at all times. And so it allows for that acne or that cystic type pustules to develop. So we have to kind of offset that, and we'll kind of talk about ways to do that. Hair loss, that's somewhat of a controversial issue, but I think there's definitely some literature that supports that you can experience some androgenic alopecia, which is a male pattern baldness that can be furthered or worsened with the use of testosterone. And that has to do with the fact that there is a percentage of your testosterone that actually converts to what's called dihydrotestosterone, which is called DHT. And DHT is a great hormone for us. It is 5 to 7 times more potent than the actual testosterone molecule, but it has a potential to cause some of that hair loss. So we have to be aware of that. Other things that you can start to see that will often occur would be what we call testicular atrophy or testicular shrinkage. So I want you to understand why these things happen, right? If I'm using testosterone, so if I'm replacing what my body used to produce, then my body, which would be the reservoir of testosterone production, would be my testicle, does not have to work hard anymore. And so as a result, you will get some atrophy or shrinkage of those testicles. And that sometimes can be a problem for some guys. Some people can be insecure about that, or they just don't like the way that looks. And so it's something you need to make sure you bring up with your clinician, your provider. Some other things that, especially early on, that I try to educate my patients on would be things like bloating or water retention. You've got to know that testosterone is what we refer to as a mineral retention hormone. So if your diet is kind of not great and you consume a lot of sodium as an example, you may feel like my hands are getting a little bit swollen. I'm getting swelling in my ankles, and that's often a little what we would refer to as an acclimation, where we may have to have a conversation of how do you clean up your diet, especially on the front end, so that you don't experience those type of situations. So I hope this was helpful. If you have any questions, please don't hesitate to reach out to us. You can email us at info@optimizedhealthnow.com, and you can go on our website at optimizedhealthnow.com to learn more.